Yeah, our next question is from a 21-year old boy. Actually, he has got enzyma. He calls atopic enzyma. Actually, it started at the age of 4. First, it came to his sister, but for his sister, it went away. But for him, it is continuing. So he has done many medicines, and yes, it's still, even though the intensity is less, it's still there. So he's asking if there is a like long-term cure for it, or what he can do about it. He has shared a picture also, doctor.
Atopic eczema.
Yeah.
Fine. So, okay. So the word atopy. So this atopy refers to, of course, atopic eczema. There's allergic rhinitis. There is bronchitis. All of these are genetic. So a lot of the responsibility for this problem can be attributed to the genes itself. So with respect to atopic eczema, what's happening at the genetic level? Uh, so we have, the skin has two layers. Just crudely saying, the uppermost layer is known as the epidermis. The lower layer is known as the dermis. The epidermis itself has four different layers, and the uppermost layer is dead. It's known as stratum corneum. This is very thin, but it is very important for the integrity of the stratum corneum, the outermost layer of the skin, to be watertight. Okay, even though they are dead, it has a lot of ceramides, a lot of cell junctions. It has to be watertight. It doesn't allow any particle from the outside of the body to enter inside. Uh, what happens in atopic eczema is there are a few mutations, a few genetic variations due to which the outermost layer of the skin is imperfect. There are microscopic openings. So when that happens, molecules within the environment, in a normal environment, get a chance to enter into the skin. And that immediately stimulates the body's immune system. When that happens, the body mounts an immune response against it, and that is what an eczema is. So, how does one go about dealing with eczema? Well, eczema is going to be there for life. Why? Because the way the skin is going to be for a person is determined genetically. We cannot do anything about one's genetics as of now. Uh, and since genetics are involved, one can expect the genes to kick in a little later in life when the stratum corneum becomes perfect. So a lot of people do see a remission in atopic eczema later on in life, but that's not the case with most of the people. So what do? We have to make sure that we are making up for the imperfect barrier by using moisturizers regularly. So that will fill up the cracks and keep the outer allergens from entering into the skin. So how often should one moisturize the skin? Well, it's a little tricky depending on what season it is, and also depending on the age of the patient, because atopic eczema begins as early as about 6 months of age, and it can be very stressful for the parents of the children as well. So moisturization has to be done ideally once in 4 to 6 hours. As quickly as the skin begins to dry up, one has to start moisturizing it. In an infant, it becomes a little challenging because using a moisturizer will cover up the cracks in the skin, but it will also end up blocking the sweat glands. So in the summer, when we apply moisturizers this frequently, we can end up causing a heat rash or a sweat rash, miliaria in children. So that's a little tricky. But as one grows up, one should always moisturize the body repeatedly. Apart from that, is there a permanent cure for atopic eczema? No, there is not. We have to just keep moisturizing it. And whenever we have eczema, we use anti-inflammatory creams. And the most commonly used ones are steroid-based creams. So that is something which is not a good thing, because steroids, once absorbed into the body, will have its own set of side effects. So we also have a lot of steroid-sparing creams, which can be slowly phased in for maintaining the remission from atopic eczema. So one needs to be very patient when managing atopic eczema. Sometimes even the entire family is involved in it. There is a procedure known as wet wrapping, where a moisturizer is applied to the skin, and then 2 layers of tube socks are applied to the skin, to the child. So So a lot of things can be done for atopic eczema, but there is no cure for it.
Yeah. Thank you, doctor. That was a tough one.
Very tough. Yes.
Yeah.